what we're seeing now is people are okay until they have the booster. That's what I'm seeing with my own eyes. It's the boosters that people are then getting a relapse of their melanoma or a B cell. The B cell was certainly predicted by some that if you keep stimulating B cells non-specifically, you're more likely to get lymphomas and things. And we now know that a lot of people have low-grade B-cell malignancy, chronic leukemia, very low-grade lymphoma. So perhaps it's just revealing these diagnoses in the people there. But again, we've got a logic to it. If it's suppressing the innate immune response, that is the immune response we know contains melanoma and B-cell malignancies. So it all fits. Therefore, I believe we have a duty to bring this to everybody's attention. And the regulators have a duty to see, is this really true? Because it's not going to show up in death figures for several months, by which time it could be a catastrophe.
There is increasing amounts of data, both clinical, observational, and epidemiologic, showing a huge increase in cancers. And, Ryan Cole in his practice has seen an explosion in cancers in ever younger people without risk factors. And there's lots of good mechanisms to explain why that would occur after vaccine. So whoever's asking that question, it's a big deal. I mean, I've been talking, I have a couple of, I call them informants, but I have this one nurse that I talk to who works inside of a big academic medical center. And what she's describing to me in the cancer center is nothing short of disturbing, remarkable. I mean, she's telling me that they're seeing younger and younger patients with advanced cancers. They're seeing so many cancer patients that their infusion suites for chemotherapy, they've run out of room and scheduling. So some doctors are trying to create infusion suites in their offices, and that the ORs are full. And then case managers that follow cancer patients, their normal census over like a quarter would be like 300 patients, 200 to 300 patients. Some of their censuses of cancer patients they're following are going up to 1,000. And again, I don't want to sound overly dramatic, but the data on cancer is truly alarming.
Well, what we're seeing is also that people are starting to talk about the cancers which are appearing. Doctors are seeing them, and also the number of cases of cancer which are much advanced when they're first recognized, and also they have distant spread. It's quite remarkable. Charles, are you seeing something like this in your practice?
Yeah, in fact, I wanted to talk about one of my own patients. It's fascinating as a family doctor. Over the years, a small percentage of the new cancer diagnoses would unfortunately be stage 4 at first diagnosis. But in my practice now, it's approximately 2/3 of all cancer diagnoses since the vaxx rollout are stage 4. And so, pathologists around the world have noticed this, that unfortunately now the people who had previous cancers which were in remission are flaring up since their shots because of the damage to their immune system by the COVID shots. But new cancers being diagnosed, the tumors are bigger than ever. They seem to grow very aggressively, spread very aggressively, and be very resistant to treatment. So this has been nicknamed turbo cancer.
100% of my cancer patients who took the shot, 100% of them that was in remission is completely now out of remission, and the cancer came back not even like before. It's completely spread. So it's really been devastating. And like I said, I'm not removed from the situation. I do see these patients.
I was on a big Zoom call with a large group in New York yesterday. So one gal was talking to the gal doing her mammogram, and she said, "Are you seeing an uptick in breast cancers?" She said, "Are you kidding me? We're seeing tons of 20 and 30-year-olds coming in with breast cancer, and about 99% of people in their population are jabbed." And so a radiologist here just across the state calls me and says, "I just saw 2 high-grade breast cancers in 2 31-year-old women 4 weeks after their booster." And chair of oncology at a large hospital in Florida just a month ago said, "Hey, doc, thanks for speaking out. I usually see an aggressive brain cancer in a young patient about every decade or so. I've seen 5 in the last month." after the boosters. And so left and right, wherever I go, the medical community is starting to speak up and confirm what I'm seeing. In England, a week and a half ago, same thing. A doc came up to me, a doctor from Ireland, doctor from England, a nurse who's been in medicine for 30 years. They're like, hey, we're seeing it, and it's in young patients, and it's aggressive, and we have patients that have been cancer-free for 3, 4, 5 years. All their scans are clear, they get that booster, and now they have stage 4 disease again.
I spoke to a 27-year-old medical school graduate from a medical school here in Canada, and she said to me, Sam, you know what's really weird? And she didn't know my background or anything, apart from that I was an MD. And she said, I'll tell you, I got double vaccinated because I was threatened to be kicked out of my program. But something very strange happened this year. I said, well, what's that? She goes, well, normally we get maybe one cancer diagnosis in our graduating class, maybe one, usually 0 to 1 a year. We had 6 this year, 6 in their graduating medical school class. Okay. And she told me that one of her best friends in her class had a testicle removed because of cancer. He was healthy, athletic, no pre-existing conditions. And I said, well, what do you think it's from? And she said to me, you want to know the truth? I said, yeah. She goes, I think it has something to do with the vaccines. It's a 4th-year medical student, just graduated, telling me this. Mm-hmm. And I had not discussed anything of that nature with her at all.
So cancer, yes. Cancer, the number of cancers and aggressive types of cancer as well that we're seeing. Very short term between diagnosis and death as well. So yes, I can categorically say an increased number of cancers.
Well, yeah, I would agree with that. And in fact, to extrapolate, as a funeral director who engages with his family, because it's a small run for funeral home, the phone rings, I answer the phone, I attend the scene of the death, and then deal with the fact all the way through. So you get quite a good relationship with the family, and they at some point they tell you the story, and you kind of say, well, what happened to mum? And they tell you the story. Mum had cancer. It's been a 4-year battle, and they kind of extrapolate and say, I'm getting people now who come in who have died from cancer 4 weeks, 6 weeks, 8 weeks. And I've never seen anything like this, and to the point where they're now labeling it turbo cancer, and that runs alongside SADS, sudden adult death syndrome. What is that? That's going on the death certificate. 30-year-olds, 20-year-olds, in unprecedented numbers.
So I've been doing this for 21 years. I can't tell you that I've never seen somebody that was diagnosed with cancer and died a short time later. But I can tell you that was an extremely rare event. Okay? Most of the time when I've dealt with cancer patients, people that die of cancer, there were obvious signs these people fought the fight. They lost their hair, they lost a ton of weight, they had tumors that were visible. You can tell they were very, very sickly for a long period of time as they battled with cancer. That is the norm from what I've been used to. But I can say that here lately, most of the people that I find out died of cancer, just on the outside appearance, a full head of hair, look relatively healthy, and you find out they had cancer and died a short period of time later. That is different. Kelvin, a lot of times, ladies had just as much hair as you when they were dying of cancer. Right.
They must have looked sexy.
But now they have, I'm seeing them and they have a full head of hair. Wow. Again, a lot of times I would not know they had cancer had I not been told. Now I was curious if Brenton and John have been noticing the same thing.
Yes, I would say exactly the same thing, where outwardly there's no sign of battle at all. They've literally could have died of anything, and externally you wouldn't know, whereas it was painfully obvious in some people.
I'm Kimberly Biss. I'm an OBGYN that practices in St. Pete, Florida. I can definitely say since the vaccine rollout started, we have seen in our practice a decrease in new OB numbers, which would be infertility, by about 50%. We've also seen an increase in miscarriage rate by about 50%. And I would say there's probably about a 25% increase in abnormal pap smears as well as cervical malignancies in our area.
The pattern that I first noticed of increased cancers, and particularly aggressive cancers that seem to metastasize very rapidly. And again, I noticed it in the doctors, in the physicians. And what's interesting is when you look at the increased physician mortality and the sudden or unexpected deaths, they're actually skewed towards the younger doctors. So it's doctors in their 20s, 30s, and 40s that are actually seeing a far higher mortality rate than doctors in their 50s and 60s. And that's where these cancers show up in these young individuals. And these cancers are very unusual. They tend to present quite late, so usually at stage 3 or 4. And they tend to be very aggressive and almost resistant to conventional treatments, to conventional chemotherapy or radiation. And so that's where I first noticed this pattern of these cancers that, for example, I had a 27-year-old doctor in British Columbia, a medical student, who after 2 COVID-19 vaccine doses, about a month or 2 later, started developing back pain. And then he comes down with this very rare spinal cord cancer that grows very rapidly. At first, doctors thought that they could treat it and it was, treatable and he could be, put in remission. But it just progressed too rapidly. They operated and they realized on the pathology results that they could not offer him any treatments, and he was dead within a matter of months. And you start seeing these cancers all over the place.
Yeah, we are seeing in the United States a lot of very unusual cancers in young people, aggressive lymphomas, leukemias, and interestingly, colon cancers in people in their 20s and 30s. I mean, there's a reason we don't normally start doing screening colonoscopies until age 50, 40 or 40 at the youngest if you have a strong family history, but never in 20s and 30s. All of a sudden, we're seeing aggressive colon cancers, testicular cancers in young, healthy people.
Breast cancers in younger and younger women, breast cancers that start off as a little lump, and then within a month or 2, they will grow to 10 centimeters size and replacing the entire breast. Now you need to do a radical mastectomy, you need to do very aggressive chemotherapy. And I have parents coming to me and saying, what do I do about this? This is something that even the oncologists have not seen before, and they don't know what to do with these cancers. So breast cancers, I've seen even gastric cancers behave very strangely, testicular cancers, especially in athletes. In the German Bundesliga, there's soccer players that are, there's a dozen soccer players that have come down with testicular cancers, all of them in their 20s and 30s. So, this is a very frightening situation.